would love to see them no longer survive, and it's really unfortunate. The question is, who do you want to control your healthcare decisions? An HMO bureaucrat? A government bureaucrat? Or do you yourself want to be in charge of your healthcare decisions? Universal choice is the key to universal coverage in this country. Moving to patient-centered solutions will ensure we have universal coverage with affordable, accessible, quality health care. This excitement over government-mandated universal coverage as a solution to our problem will once again lead us down the path to a single-payer, Canadian-style Medicare for all system. These programs that Pelosi and Reid and the President are talking about, taxes up, quality down. Canadians come to the United States. Where are the best doctors in America, and where will we as patients go if we get this style of a single-payer healthcare system? As P.J. O'Rourke says, if you think healthcare is expensive now, just wait until it's free. And finally, the Hippocratic Oath says, first, do no harm. This should be the objective of our politicians. First, do no harm. Thank you.
If you have questions, line up on this side of the room and ask them. I would caution you to ask a question and not give a speech. We've had enough of that in the past. So just ask your question, make it brief, because there'll be a lot of people interested in asking questions. Please do not give a long talk. Thank you.
We have our first question, and I want everyone to note that our audience is getting younger.
Thank you so much. It's a pleasure. Yeah, I just wanted to comment, if this Bolshevik bill passes, this Canadian healthcare is a dream for us. I come from the Soviet Union, if it passes, we might end up as the Soviet Union. You have to drink a bottle of vodka for anesthesia, party and surgery at the same time. But what I wanted to mention is that everybody know probably that in California they want to pass the bill, healthcare bill, not the 2,000 pages, this big one, but the small one, 84 pages. They want to pass it in California. What do you think about this? Thank you.
Well, somebody said to me on Monday morning at a meeting, did you hear Jay Leno talking about a single-payer health care system? I said, I didn't know he talked about those things. He's sort of a comedian. But then I realized it was Mark Leno, and he, the Senate, single-payer health care in California has been around for a long time. When I moved here in '91 from Canada, there was an initiative on the ballot, Prop 186, which was a single-payer initiative. It was defeated by the largest margin of any initiative. But, Mark Leno wants this. Sheila Kuehl has had several versions of single payer. There is a big element. But the people in California, when they voted on the initiative, have voted it down. I don't think a single payer initiative, we're already $20 billion in the hole in California. The cost of one of this would probably be, well, Arnold predicted it was going to add tremendously to the budget deficit when he had his own individual and employer mandate plan. So I just don't see how it will pass the Assembly, or if it does, I just can't see that Governor Schwarzenegger would sign a single-payer bill. And interestingly, in Virginia and several other states, they are now passing bills, and the Democrats in Virginia even supported the idea, saying that an individual mandate in the state of Virginia is illegal. So, God forbid if California, gets out of step with the Army.
How do you respond to the criticisms about the greedy drug companies and that we ought to have cheap drugs like they have in Canada?
Oh, yeah, that's one of the myths in my book. And I just spoke in Orlando. I debated a Canadian in Orlando on this whole issue. Byron Dorgan, Senator Byron Dorgan, is not running again, but he's been a huge supporter of drug importation from Canada. The president is a big supporter of drug importation, and David Axelrod said if it's not part of the bill, because the amendment did not get into the Senate bill that Dorgan had proposed, David Axelrod said we're going to get drug importation anyway. The interesting thing is that in the pharmaceutical biologic industry, the industry spends about $65 billion a year on research and development for drugs and biologics. Most of the research and development for drugs and biologics is done in the United States. It's no longer done it's not done in Canada, England, France, Germany. Companies have to make a return on their investment. And because we don't have price controls on pharmaceuticals, all the big European companies moved to the United States so that they could do research and development. It costs about $1.3 billion from a drug idea to getting it through all of the trials, through the FDA, and it takes a long time, and there's usually only about 8 to 10 years left on the patent. But the problem is that politicians say, oh, well, this drug is cheaper in Canada than it is here. Well, the reason it's cheaper is because after we've covered the cost of R&D on our backs, we can sell to other countries at a lower price. The thing that a lot of people in America don't realize, that a lot of drugs that are new here and are cancer-curing drugs, they are not available on the formularies in countries like Canada. People don't have access. So, the ideal thing would be to get countries like Britain and France to remove their price controls so that we can level the playing field and all, can be involved in the cost. As Frank Lichtenberg at Columbia said, for every $1 spent on newer pharmaceuticals, we're also saving $7.17 in hospital costs. One of the big parts of Obama's healthcare plan is this whole idea of comparative effectiveness research. And there's just a new agency in the budget, Agency for Healthcare Research and Quality. For those of you who don't talk about comparative effectiveness research at the dinner table every night, it is a program patterned after a British program under the National Health Service called NICE, the National Institute for Health and Clinical Excellence. And in fact, I was in London just after Christmas, and Andrew Dillon, head of NICE, was given a peerage, and he is now Sir Andrew Dillon. There was huge outcry in the media by patients, because what NICE, or what comparative effectiveness does, is it decides which drugs are cost-effective as compared to medically effective. So if the value of your life is $45,000 based on what the government actuaries say, and you come down with kidney cancer, and the new drug for kidney cancer is Sutent, and they say that it probably would be medically effective for you, but if the Sutent costs $55,000, the value of your life is $45,000, so you are not entitled to that drug because it is not cost-effective, maybe medically effective. So this is something that the president is really pushing, and he says, oh, we only want to reduce costs by making sure that we're comparing, that this drug, might be cheaper and it could be as good, so why should we be spending more money? I can tell you the ultimate thing of comparative effectiveness research is government actuaries deciding what drugs are cost-effective and not being concerned about medically effective.
We have another young lady here.
So you mentioned selling insurance across state lines. And so when this was asked of my representative, Michael Honda, he told us that this was not a federal issue, that only the states were able to take care of this. So I wanted to know, is this a state issue, or can the federal government help get the insurance companies competing across the states?
Yes, it falls under the Commerce Clause, and it can happen. I will tell you that the insurance companies are not very excited about the idea of people being able to buy insurance across state lines. In particular, in a state like California that has 45 mandates, from hair prostheses to alcohol rehabilitation, all of these mandates add between 20 to 50% to the cost of an insurance premium. So as I said, New Jersey and New York have the most expensive because they have guaranteed issue and community rating. In Massachusetts, one of their mandates is